tuberculosis claiming over 4,500 lives a day around the world, and the emergence of multi-drug resistant TB continues to pose a major health security threat, and it could also risk all gains made in the fight against diseases, or against the disease. I want to take you to Cape Town now, and standing by to talk to us, you can see her in the screen behind me, is Dr. Jennifer Hughes from the organization Médecins Sans Frontières, or Doctors Without Borders. Doctor, good afternoon to you and welcome. So we were hearing from the South African Medical Association earlier today that the diagnosis has got better, but there remains a problem with infection control. To what extent is that bedeviling the process within the sphere in which you operate?
That's right. So tuberculosis still remains the leading infectious disease killer in South Africa, unfortunately. Every year, nearly 500,000 people are diagnosed with tuberculosis, with around 5% of those being multi-drug resistant tuberculosis, or MDR-TB. This is a problem for South Africa because if we want to get on top of the epidemic, we really need to be finding all of those cases, not just knowing they're out there, but finding them, getting them onto treatment, and getting them cured. That's the only way that we will halt transmission. So while there's a huge gap in detecting everybody that's out there, we really need to be making efforts to find them.
Why is there a problem then in the detection?
Well, people often go to test for TB, or they go to their healthcare facilities thinking they're sick, and they might give sputum and not come back for the results, or they might suspect what the results might be but be afraid of entering to start treatment. Everybody knows that tuberculosis treatment is at least 6 months. If you have the stronger, more resistant forms of TB, then it's up to 2 years of treatment. So some people aren't ready for that, and some people aren't willing to disclose their disease status because there is still the stigma with HIV, unfortunately.
So what I'm surmising now is that if you improve detection mechanisms in this respect, that's only half the battle won, because you've then got to convince those people who you have found to assume and to continue and to sustain the regimen.
That's right. It's like a leaky cascade, really. You know, you try and make efforts to find everybody that's out there. You're not going to find everybody just by expecting people to present to your healthcare facilities. We need more active screening strategies to go to communities, to households, to try and screen people. And then once they do come, you know, you diagnosed TB or drug-resistant TB, and those people are reluctant to get onto treatment for whatever reason. So we're missing a lot of people right at the beginning of that cascade. That's even before we start talking about effective treatment that's available.
So what happens if the current trend continues? What impact does that have on the broader fight against TB?
Well, we must remember that we've made huge strides in the world of TB over the past few years. So there have been really strong efforts from the National Department of Health and NGOs all across South Africa to improve case detection. So that has been improving, and the diagnostic techniques have helped us as well. So having much more rapid diagnostic techniques which don't rely on lengthy processes have helped us to diagnose more quickly. So it looks like we might be detecting more people, but actually it's just those that were out there that we're actually now finding. So the message that we're now trying to get out is to say TB is curable. Come and be tested, get your treatment and be cured. Even in the realm of drug-resistant TB, we've made great strides in diagnosis and actually accessing effective treatment for people who need it. So it's no longer a death sentence. It is curable. We just need to convince people to come and be cured, come and get onto treatment.
So like any problem the world over, it's about better communication. I do accept that. I'm just wondering, and this is a final question to you, the profile of people affected, is that changing in any way, or is this a disease that strikes across all demographics?
So the age-old message is that anyone can get TB. Some people are more at risk, and those kind of people are people whose immune systems are not functioning correctly, so people who are very young, very old, those with diabetes, with cancer, who are on steroids, who have HIV, but also people are more at risk if they're in very crowded situations, and if they're exposed to other people with TB. So, for example, people in prisons, people in mines, and in health centres. So those are really the groups that we're trying to target, to say, be aware of TB. If you have a cough for 2 weeks or even less and you're worried, you're losing weight and you're sweating at night, go and get a test. The test is simple, it's easy to do, and the treatment is effective, and you can be cured from TB.
Live in Cape Town for Newsday, that's Dr. Jennifer Hughes from the organisation Médecins Sans Frontières, or Doctors Without Borders.